Now, a little bit of additional information for you that this Guyon's canal syndrome has been divided into three types depending upon the site of injury and the type of fibers involved, like sensory or motor or both. So, for the convenience of study, we have divided into three zones. These are the three different zones of injury. Zone 1, as you can see, is the entrapment of ulnar nerve before or within the Guyon's canal, like between the pisiform and hamate, or even before entering into the Guyon's canal. So that is zone 1, where there will be both motor and sensory loss. Now zone 2 is compression of motor branch, that is the deep branch of ulnar nerve. So you know that the deep branch takes a curve laterally within the curvature of the deep palmar arch. So if there is compression of the deep branch of ulnar nerve, you can imagine the 14 out of the 15 muscles, those are innervated by the deep branch, they will be paralyzed. And of course, that will lead to partial claw hand. Now, zone 3 is the least common and with the minimal damage, and that is the injury of the superficial branch of ulnar nerve. You know that the superficial branch is mainly sensory. It gives cutaneous innervation to the medial 1.5 digits and a single motor branch to the subcutaneous muscle called palmaris brevis. So in case of type 3 injury, there will be mainly sensory loss, but there will be hardly much motor loss. So you have these three zones, the three types of injuries of the ulnar nerve related to Guyon's canal syndrome. Remember that the partial claw hand or the ulnar claw hand will be seen in type 1 and type 2 injury. That's injury of ulnar nerve in zone 1 or zone 2. That will lead to partial claw hand, and type 3 injury will lead to only cutaneous loss in the middle 1.5 digits. Type 2 injury will lead to only motor loss, while type 1 injury will lead to both sensory and motor loss.